What is azithromycin?
Azithromycin is an antibiotic effective against bacterial infections such as bronchitis, pneumonia, and infections of the skin, throat, sinuses, lungs, ears, and reproductive organs.
Azithromycin uses. Azithromycin treats bacterial infections, excluding viral infections like cold and fever.
It can be combined with other antibiotics to address conditions such as Mycobacterium avium complex and sexually transmitted infections, STIs. Azithromycin is also effective against gastrointestinal infections, lung infections, whooping cough, and diseases caused by ticks.
Azithromycin side effects.
If you have any of these following serious symptoms, immediately contact your doctor for further assistance.
In any case, due to azithromycin, if you get any kind of reactions in your body, try avoiding it. Common azithromycin side effects: abdominal pain, vomiting, headache, dizziness, itching, swelling of face, yellowing of eyes, loss of energy. Serious azithromycin side effects: liver problems, weakness, dark urine, pale face. QT prolongation: it can cause irregular heartbeat, chest pain, gasping during sleep, fainting, allergic reactions, breathlessness, pale face, hives, skin reaction, diarrhea, fever, stomach pain, nausea, reduced appetite. Trust your doctor's recommendation regarding azithromycin, as the benefits usually outweigh potential side effects. Seek immediate medical help if you experience severe reactions. Precautions while taking azithromycin. Prior to taking azithromycin, consult your doctor regarding your medical history, especially if you have a history of liver disease, kidney disease, or certain muscle disorders. Be aware that azithromycin may increase your heart rate, leading to QT prolongation, which can result in irregular heartbeat, dizziness, and fainting. The risk of QT prolongation may be heightened if you have certain medical conditions or are taking other medications known to cause QT prolongation. Individuals with low levels of potassium or magnesium in their blood may face an increased risk of QT prolongation. Avoid using azithromycin if you have faced these problems. If you ever got allergic.
If you have jaundice or liver problems after taking azithromycin.
If you're getting some reactions due to clarithromycin and telithromycin. Inform your doctor if you have these problems. Liver disease, kidney disease, myasthenia gravis, heartbeat disorder, low levels of potassium in the blood. How to get rid of the side effects. Nausea: avoid eating spicy foods while taking azithromycin. Try to have simple meals. Diarrhea or vomiting: try drinking enough water to avoid dehydration. Drink a small sip of warm water if you're sick. Avoid using any other types of medicine for the treatment of diarrhea and vomiting. Losing of appetite: eat small meals for every 2 to 3 hour break. Try having nutritious snacks which are high in calories and protein. Headaches: drink plenty of water. If you are facing a severe headache, ask your doctor to prescribe you with painkillers. Dizziness or tired: rise and sit slowly if feeling dizzy while standing. Lying down may further alleviate symptoms. Avoid smoking and alcohol consumption to manage dizziness effectively. Azithromycin is utilized for lung infections in HIV patients. Specifically, azithromycin is prescribed for children to address ear and chest infections. Azithromycin is available in various forms: tablets, capsules, syrup, eye drops. How to take azithromycin. Azithromycin is available in tablet, syrup, and capsule forms for various infections. Tablets are typically taken once daily with or without food for 1 to 5 days, or weekly for disseminated MAC infection. ZMAC should be taken on an empty stomach, usually at least 1 hour before or 2 hours after a meal. Take azithromycin at the same time daily to minimize side effects, following the doctor's advice or prescription. Shake azithromycin syrup well before use and use a dosing spoon or measuring cup for accuracy. Rinse the measuring device before and after use. If using azithromycin powder, Zithromax, in single dose, mix it with water before consumption. Vomiting within 1 hour of taking the medicine requires consultation with the doctor regarding the next dose.
Improvement is typically noticed within a few days of azithromycin treatment, but consult the doctor if no improvement occurs.
Forms and various strength.
Generic, azithromycin, tablet, and 250 mg, 500 mg, and 600 mg.
Brand, Zithromax, tablet, 250 mg, 500 mg.
Shake azithromycin syrup well before use and use a dosing spoon or measuring cup for accurate dosage.
Rinse the measuring device with water before and after each use.
Mix the 1 gram packet of azithromycin powder, Zithromax, with a quarter cup of water and consume it immediately.
If you vomit within 1 hour of taking the medicine, consult your doctor immediately for guidance on whether to take the next dose. You should start feeling better within a few days of starting azithromycin treatment. If you don't see any improvement, consult your doctor. Dosage of azithromycin.
Bronchitis, adult dosage in 18 years and older, an adult should take 500 mg per day for 3 days. A doctor can also prescribe 500 mg as a single dose on the first day, and for the other 2 days, he may advise you to take 250 mg. Sinusitis, adult dosage is 500 mg per day for 3 days, child dosage, 6 months to 17 years, should take 10 mg per kilogram of body weight once in a day for 3 days. Skin infections, an adult should take 500 mg per day for 3 days. Doctor can also prescribe 500 mg as a single dose on the first day, and for the other 2 days, he may advise you to take 250 mg. Urethritis and cervicitis, if you are not treating gonorrhea, then you can take 1 gram dose in a day. If you are treating gonorrheal infection, then 2 gram in a day. Ear infection, child dosage, 6 months and 17 years, 30 mg per kilogram of body weight as a single dose. The doctor may also prescribe 10 mg for 3 days. Missed dose, missing 1 or 2 doses of azithromycin won't affect your body. However, taking the dosage on time is crucial for its effectiveness. If you miss a dose, take it as soon as possible, as advised by your doctor. Overdose. Accidental drug overdoses can have harmful effects on your body's functions. If you've taken more azithromycin tablets than prescribed, it could lead to a medical emergency. Azithromycin warnings. Allergic reaction. Trouble breathing. Hives. Swelling of throat or tongue. Some severe skin reactions. Don't take this drug if you have any allergies, it may cause you serious medical conditions. Consult a doctor immediately in such cases. Warnings for serious health conditions. Myasthenia gravis. If any person has myasthenia gravis, then the drugs may lead to some worse symptoms. Before taking azithromycin, consult your doctor. Heart problems. If any person is facing difficulty in breathing or they are facing some abnormal heartbeat called QT prolongation, then taking this drug can increase the arrhythmia. Consult your doctor. Pregnant women. Azithromycin is not extensively evaluated for use during pregnancy. While there's no significant risk of pregnancy loss or birth defects associated with its use, it's advisable to consult your doctor before taking the medication. Breastfeeding. Azithromycin passes into breast milk, potentially causing side effects in breastfed infants such as diarrhea, vomiting, and rash. Prior to taking azithromycin while breastfeeding, consult your doctor. Azithromycin storage. Store azithromycin at room temperature between 68 degrees Fahrenheit and 77 degrees Fahrenheit, 20 degrees Celsius and 25 degrees Celsius, to prevent damage from heat, air, and light. Before taking azithromycin, consult your doctor. If you experience any side effects, seek medical attention immediately. Carry your medication while traveling and follow your doctor's advice and prescription diligently.